Hello, good morning or good afternoon. I'm Jo from Specialist Language Courses, and today I'm going to take you through an OET medicine letter. So what we'll do is we'll go through the letter after looking at the case notes, and then we'll do a bit of analysis based on the OET writing criteria and analyze how well this student has done. Okay, the set of case notes we are going to use are Mr. Adam Knowles, and they are available on the OET website. It's one of the free sample writing case notes, and it's medicine sample test 4. So we'll just have a little look at the case notes first of all. Right. Okay, so first thing I'm going to do is just look at the notes. So we've got, you are a doctor in a city clinic. Mr. Knowles is a new patient in your surgery. But I think it's like you're his GP. And then if we go down to the writing task, we need to write a letter of referral to Dr. Desai, who is a gastroenterologist, for assessment of Mr. Knowles. Okay, we might have a quick look at the end here. So urgent referral, so it's urgent. So it's for assessment and endoscopy for possible pancreatic malignancy. The patient is aware of the possibility. So we've got the situation here. So we're suspecting pancreatic malignancy and we need urgent assessment and endoscopy. And that's why we're writing. And our patient's name is Mr. Adam Knowles, and he is 68 years of age. So let's take a brief look at the information. So we've got social background, married, physically active, non-smoker. Not much of that is relevant. You might want to mention that he's a social drinker, just because it's all related to, I guess, the gastrointestinal system, but I don't think you have to. Nothing significant. And then we've got all this information here. Severe childhood eczema, gallbladder removed due to gallstones. That was quite a while ago. You might want to mention it, but I don't think it's essential information because it's not related to the current situation. History of depression, not so relevant. I think maybe his medication might be relevant. They might be interested in what goes into his body. So let's look at the patient's story and get a sense of what's happened to Mr. Knowles. So 2nd of August, he came with heartburn and indigestion. Over-the-counter antacids were ineffective. He thought it was a hernia. Okay, so what happened? So we had a full examination, nothing abnormal detected. Wait, what did we do? So we commenced him on omeprazole for 8 weeks. We ordered some tests and we asked him to come back in 4 weeks. Okay, and then he came back. So this will be today. No improvement in his symptoms. He's now got back pain and some new symptoms. He's lost a lot of weight. So in 4 weeks, 2 kilograms. And his abdomen is tender and slightly swollen, and he's showing signs of jaundice here. And then we've got his pathology results here from what you took in the first visit. So quite a lot of that is important. I think you would mention the test results, absolutely. And I think you will probably mention most of this. So no improvement in symptoms. Now he's got back pain. He's now got that. He's lost 2 kilograms since the last appointment. His abdomen is tender and slightly swollen. And yes, yellow discoloration. So we'd mention the test results, absolutely. Obviously, if we mention that, we can link that together. So let's look at what we would include from the first consultation. So obviously this is the most important information here because it's the current symptoms that are leading you to suspect malignancy. So we might just provide a little bit of background. So we might say he first came with indigestion, heartburn. He'd been trying antacids. Hernia, I mean, you might, but it's not really relevant because it's not a hernia. You might say that you didn't notice anything. You might mention his current weight. I think the most important thing to mention is that he lost weight and quite quickly. And yeah, I would mention the treatment that you did. No need to mention the ordering of the tests, really. You can say, you know, tests were ordered for review in 4 weeks, but it's not necessary. What's more important is probably the actual test results and the findings. Okay. So we've got an idea now of what we would want to put in our letter. So shall we take a look at the sample letter? Okie dokie. All right. Let's do a new share. All right. So what we're going to do in this letter is we are going to, now we've looked at the case notes, we're going to look at a student sample letter. And then we're going to analyze it based on the criteria. So if you don't know already, the criteria is available on the OET website, the link's here. Purpose is out of 3 points. And content, conciseness and clarity, genre and style, organization and layout, and language, they are all out of 7. Okay, and ideally you want to be getting, well, 7 and 3 if you can, but ideally 2s and 3s, and you want to be getting 5s and above to have a good chance of getting an OET-B. And if we look at that criteria in a bit more detail, you can see that when it's under band 5, so if we look at band 3, which includes band 4, you know, it's some key information missing, distracts from the overall clarity, may distract the reader. Organization, not always logical. Key information may not be highlighted. And here we've got strain for the reader. So obviously in a medical situation, like working in a hospital or GP, strain and missing information and distractions, not so great. So I guess that's why we need the score to be high enough in the OET exam. So just get rid of that. All right. So we are going to take a look at the letter, and then we'll look at all the criteria. So we'll look at purpose, we'll look at content, and we'll analyze it based on the criteria. So let's look at the letter now. Oh, 1 second. Okay, here is the letter. All right, so we've got the student sample letter. First glance, the letter layout looks fine. We've got the address here. We've got the Dear Dr. Desai. We've got the reference. We've got the date. We've got yours sincerely and doctor. So at first glance, it looks pretty good. Let's look at the address. Well, we know we're writing to the gastroenterologist, so you should put the job title, if given, gastroenterologist. So I'll pop that in there, and then the rest is fine. And then let's look at the purpose. Thank you for seeing Mr. Knowles, a patient at my practice who has possible pancreatic malignancy. Your assessment would be appreciated. I think that's fine. It's very clear. I know who the patient is, what the possible medical condition is, and what's required, the general purpose assessment. I mean, we could put in about the endoscopy as well here, but if we put it later, then you don't need to. I think the general purpose, I mean, endoscopy is part of an assessment. What I would do is perhaps split this into 2 sentences, just so that it's clearer. So that reads a bit better. Okay, so on the 2nd of August, Mr. Knowles first presented with, okay, they were not relieved by over-the-counter medication. That's fine. I might want to connect that together by using which. I think that would be better. Which were not, so he first presented with heartburn and symptoms of indigestion, which were not relieved by over-the-counter medication. Great. A full exam was performed and nothing abnormal was detected. Fine. He was prescribed a course of 8 weeks of omeprazole, 20 milligrams twice daily. Great. I also ordered FBC and a liver function test and asked him to return in 4 weeks' time. Okay, I think that's okay. Perhaps don't need to include this, as I mentioned before. We've got, please note, he underwent a cholecystectomy in 2008 due to gallstones, and he has a 4-year history. He's a non-smoker, active and drinks socially. He has no significant family history. Okay, there's quite a lot of information. We probably don't need to include this, and if there's no significant history, then no need to mention it. I'm not sure this is the best place to put this information. I'm just going to highlight it and we can think about that later. So let's continue. Okay, so we've got today, Mr. Knowles reports that he has no improvement in his reflux symptoms and he is concerned about his back pain. He presents with fatigue, diarrhea, pale stools, in addition, abdominal pain, which occurs when he's eating. Okay, the information there is fine, but this in addition doesn't work. So it's in addition to. So in addition to works like a connector, like and as well as. So in addition to, in the middle of a sentence, is akin to and or as well as. If you're going to use in addition, you need to use it with a comma at the beginning of a sentence only. Okay, it's not a connector. Okay, so let's read that through today. He has no improvement in his reflexes and he is concerned about back pain in addition to abdominal pain. Okay, on examination, comma, his abdomen is tended to palpation, which seems slightly swollen. I'm not sure the which works here. If we're going to use the which, we need to have what it's referring to immediately before. So you see here at the beginning, we've got symptoms of indigestion, which were not relieved by over-the-counter medication. So here the which is referring to the symptoms of indigestion. Whereas here, tended to palpation, it doesn't really work. So I think it would be best to say and. Yeah, sometimes and is the right word to use. You don't need to overcomplicate your language. Okay. He lost 2 kilograms in the last 4 weeks and he's showing signs of jaundice. Okay, this is the wrong tense. So have a think about what it should be. So if we're talking about the last 4 weeks, it's past to present. So we don't want to use past simple here. That's right. We want to use present perfect. He has lost 2 kilograms in the last 4 weeks and we're missing a verb here. He's showing signs of. The correct phrase, he is showing signs of jaundice. Okay, so I think this is a pretty good paragraph. It's got all the important information. It's missing the blood results, but they are reported in the next. Okay, blood blood results show, I would put maybe his or the blood results show affected liver and pancreatic functions with high levels of his bilirubin. I would take out the his, just high levels of, and then the substance, and of his alkaline phosphatase 120. I would say, and his alkaline is. So when you're reporting test results, make sure you're using full sentences and not just listing them, because you want to demonstrate your English. Anyone can list. All right, and then we've got, in view of the above, I believe he has pancreatic malignancy and he requires urgent assessment of his condition. Mr. Knowles was informed about his possible diagnosis. I would use present perfect because it's recently and he has the information now. But what information are we missing from the case notes? We go and have a little look at them now. Endoscopy. It's missing the endoscopy. So I think we really need to include that. So and requires urgent assessment of his condition and an endoscopy. That's key information that's missing. You know, I mean, they might perform the endoscopy as part of the assessment, but for OET purposes, if it's in the case notes is what you need to request, you must request it. Otherwise, you're going to lose marks for content. Okay, so it's very important. So let's go back to this highlighted in yellow. Yeah, I would move this to the end, probably. I think it's not so important. It's background information. I mean, I'd put it maybe at the beginning and get it out of the way with, but even then I would perhaps get rid of that and just add it at the end here if you're going to put it anywhere. Yeah. Yeah, I think that's better there if you're going to put it anywhere. That way you've got all the information here about what happened and the progression. Then you've got his blood test results, and then you've got what needs to happen. And I think all the important stuff, all the important information is first. And I think that's something to think about when you're planning your letter. What order are you going to put it in? Okay, so it's quite a good letter, but not perfect. There's a few things to change about it. So let's have a look based on the criteria, and we'll analyze it section by section, starting with purpose. So it was good, yeah. It's clearly stated at the beginning of the letter, and it's expanded quite well later in the letter. So we've got it here at the beginning and then here at the end. However, the urgency could be made clear at the start. So remember when we looked at the case notes, it was urgent assessment. So I would perhaps mention that. I think it's quite well expanded, but it's not fully expanded because it's missing that endoscopy request. But I think we'll talk about that more in content. But generally, the purpose is clear. So looking at the content, there's relevant information needed by the reader to complete the required action. Yeah, we've got the action to be taken clear at the end of the letter as well, but it's missing the endoscopy. So here we've got some relevant information. So what happened first of all? And then here we've got today, which is quite important. So it's the current assessment and of course the test results. But yeah, one thing that is missing is the endoscopy. We've got the preliminary diagnosis and the urgent assessment, but we're missing the endoscopy, and that would unfortunately reduce the score. Okay, let's look at conciseness and clarity. It's a bit long. So this letter is 250 words, and there's quite a few irrelevancies which distract the reader from the main focus of the letter. So see here, I've crossed out some phrases that just aren't needed. They're a little bit distracting. So you need to think about what is the most important information and make sure that that presents as the bulk of the letter. Yeah, it needs to take up the majority of the space, and things like nothing abnormal detected. I mean, you can, but you know, the ordering of the test is not important. And the no significant family history is also not important, I don't think. I think you need to think about what you're asking the reader to do and leave out any details which they do not need to know in order to carry out this action. So yeah, as I've crossed out here, not full details of the first consultation. Yes, full details of the second, but not the first. So I've taken out some of these phrases, and this is what it looks like without all those details. And already I can see it looks a lot clearer. And the second paragraph already looks less full. Yeah. And this is 203 words, which is acceptable. It's 3 words over the limit, but I think that's fine. Okay. Let's look at genre and style. So I think pretty good. There's clinical, factual language, and it's pretty well managed here. So we've got lots of phrases: present with, symptoms of, underwent, Mr. Knowles reports, presents with, on examination, you know, all this clinical language that is the right genre and style for the task and the reader. So I think it's pretty good. If we look at organization and layout, paragraphs are clear, yeah, and the letter layouts mostly fine, but as I said, when we looked at the letter, include the job title. The ideas are grouped together quite well, but yeah, there's a few changes so that the key information is more highlighted. So remember we talked about his past medical history, perhaps not so important to go in the second paragraph. So that bit might be better going at the end there. Okay. Language, pretty good. There are some errors, but they don't cause any strain, and meaning is always clear. So we've got one here down the bottom. Mr. Knowles was informed, changed to has been. So there's a few errors with tenses. I think there was another one as well. So here are all the errors that we've got here. So there's a few, not loads, but I think it's pretty well managed. Okay, a few errors with tenses, missing an article here. So he underwent a cholecystectomy and things like, and then the error with which. And I think that's pretty much it. Okay, yeah, missing out that he is showing signs of jaundice. So it's mostly flexible and accurate use of language, and I think it would score pretty highly here. So language would probably get a band 5, I would say. Organization and layout would also score quite highly. I think perhaps a 5. I mean, key information could be highlighted more, so it might get marked down a tiny bit, but generally it's well organized. Genre and style would score well, 5 or 6. Conciseness and clarity, 5, I would say. There is some irrelevant detail. It's a little bit distracting, so that might go down to a 4. The content, unfortunately, missing that endoscopy would really reduce the language, and I don't think it would get any higher than a 4 because it's missing that, possibly lower. Everything else is there and accurate though, so it might do better than a 3. So 4 I would go with. So this is what the letter looks like, fully corrected. So let's have a read through that and see how clear it is. So thank you for seeing Mr. Knowles, a patient in my practice who has possible pancreatic malignancy. Your assessment would be appreciated. On the 2nd of August, Mr. Knowles first presented with heartburn and symptoms of indigestion, which were not relieved by over-the-counter medication. He was prescribed a course of 8 weeks of omeprazole, 20 milligrams twice daily. Today, Mr. Knowles reports no improvement in his reflux symptoms, and he is concerned about his back pain. He presents with fatigue, diarrhea, pale stools, in addition to abdominal pain, which occurs when he is eating. On examination, his abdomen, which is slightly swollen, is tender to palpation. He has lost 2 kilograms in the last 4 weeks, and he is showing signs of jaundice. Very clear. His blood results show affected liver and pancreatic functions with high levels of bilirubin, etc., etc. In view of the above, I believe he has a pancreatic malignancy and he requires urgent assessment of his condition. Mr. Knowles has been informed about this possible diagnosis. Please note he underwent a cholecystectomy in 2008 due to gallstones. He has depression for which he's been taking fluoxetine since 2016 and drinks socially. So yes, I think much better organized that way. So if you want help with your OET writing, we have an OET writing correction service. You can go to our website and there are plenty of options that we offer. So what happens is we provide you with corrected letter, like you just saw. We provide you with feedback comments on a form, predicted band scores, and check out our website. So here is our link. Here is our website. The link will be in the description below. You will be sent OET writing tasks and case notes, all be marked by one of our OET specialists. We do doctor and nurses, and there are several packages that we do. So we do just the basic one writing correction letter with feedback. So we do that for doctors and for nurses. And we also have some other packages as well. So we have here 2 writing corrections. There's currently a 20% discount going on. Yeah, you get detailed comments on how to improve and marked by one of our specialist teachers. We also do various other packages as well. Our OET practice tests, including writing corrections. You can book that with us. We also do packages of our digital course, Reach OETB, packages of that with writing corrections and practice tests. So there's loads of things depending on what you want, what level of support you want. So please do check out our website. Also, don't forget to look at our YouTube channel. There's loads of videos up there, still continuing with the current season. And thank you for watching, and just want to wish you all the best of luck with your OET preparation. And if you're taking your exam soon, good luck. Take care. Bye. Bye-bye, everyone.